Working on the chest muscles, starting at the top or more anterior, we have the pecto antebrachialis, pec major, pectoralis minor, and xiphi humerales. The abdominal muscles, we have the external oblique, the internal oblique. Here the edge stops for the internal oblique, and we have transverse abdominis, and then rectus abdominis, or the rectus sheath. With the external oblique reflected back, we can see the ribs, and between the ribs we have the intercostal muscles, the most superficial being the external intercostal, and deep to that would be the internal intercostal.
Okay.
Looking at the neck, the two muscles forming a V there are the digastrics. In between the digastrics is the mylohyoid. Down here we have the sternohyoid, going from the sternum to the hyoid bone, sternohyoid, and then kind of forming a V here, we have the sternomastoid, the sternomastoid. The final muscle here in the neck, the big cheek muscle, you can see right here real nicely, is the masseter, the major chewing muscle, the masseter.
We're going to go right ahead.
Starting looking at the superficial back muscles, we have the latissimus dorsi, this big sheet, the spinotrapezius, acromiotrapezius, and clavotrapezius, from the midline of the neck to kind of the shirt seam. The spinodeltoid, the acromiodeltoid, and the clavodeltoid or clavobrachialis. So the same name, spino, acromio, clavotrapezius, spino, acromio, clavodeltoid. And this is the levator scapula ventralis.
Whenever you're ready.
Looking at the deep back muscles, we reflect the latissimus dorsi and the spinotrapezius out of the way, and then we pull down the acromiotrapezius and we see the scapula. So the scapula is divided into the spine here. The spine divides the scapula into, the muscle above is the supraspinatus, above the spine, infraspinatus, and teres major. Here we have the teres major. And then looking under the scapula, we have the subscapularis, this muscle under the scapula, the subscapularis, and then this unusual looking group of muscles are the rhomboideus. The most anterior is the rhomboideus capitis, followed by the rhomboideus minor and the rhomboideus major that wraps around the back edge of the limb. This interesting group of muscles here are the serratus ventralis. Kind of look like a serrated steak knife here, the serratus ventralis. Looking at the upper leg, this great big muscle on the lateral side of the leg, the biceps femoris. Just anterior is the caudofemoralis. And then the two gluteus muscles, the gluteus maximus, the smaller on the cat, gluteus maximus, and then just anterior is the bigger gluteus medius. This little fan-shaped muscle kind of right coming in the upper thigh as well is the tensor fascia lata. Doing the upper thigh, the longest muscle in the body, the sartorius muscle. We've bisected it here, so when we lift the sartorius, we can see the quadriceps group. Again, because of the four muscles making up the quads. They're the vastus lateralis, vastus medialis, and deep that we can't see here is vastus intermedius, and then on top, this is the rectus femoris. So there's the quadriceps group, vastus lateralis, medialis, intermedius, rectus femoris, under the sartorius. Then moving to the inner thigh, the muscle, thin muscle covering the inner thigh is the gracilis. So this muscle is the gracilis, will reflect back. And under the gracilis, we have the semitendinosus, the semimembranosus, adductor femoris. Both of these groups are the adductor femoris, the adductor longus, and then the little thin pectineus. Semitendinosus, semimembranosus, adductor femoris, adductor longus, and pectineus under the gracilis. Looking at the calf group, or the lower leg group, we have the gastrocnemius, the lateral head and the medial head of the gastrocnemius. Kind of running between the two heads of the gastrocnemius is the plantaris muscle, and under that is the soleus muscle. All of those attached by the Achilles tendon or calcaneus tendon around the heel, the gastrocnemius, the plantaris, and the soleus. And then on the lateral anterior part of the leg is the tibialis anterior.
Go ahead.
Looking at the muscles in the arm, in the upper arm, we have the impressive triceps group, the triceps brachii. The long one in the back is the long head of the triceps. On the lateral side of the arm, the lateral triceps that has been bisected. And then deep to that we have the medial head of the tricep. Running parallel to the medial head of the tricep is the brachialis muscle. And then on the lateral side of the forearm, all these muscles primarily do the same thing, which is to extend the hand. When they contract, they extend the hand, so they're called extensors. And then one muscle that's been removed here, that's cut, is the brachioradialis. So the brachioradialis wraps around the brachialis and then should extend down here to the radius, so the brachioradialis. Looking at the upper arm from the medial view, we have this real thin muscle called the epitrochlearis. When we pull the epitrochlearis, we can see the long head of the tricep we identified before, but then underneath the pectoantebrachialis is the little biceps brachii, and the epitrochlearis. On the inside, or the medial side of the forearm, we have the flexors. So all these long, thin muscles are flexors that flex the arm and hand. Again, the extensors are on the lateral side of the arm, flexors on the medial side of the arm.